welcome to our show. Today we're going to be talking about patient action and reaction to the new healthcare system. And I want to welcome Dr. Ramsis Ghaly, who's been with us before. He's a noted doctor because he is board certified in at least 4 things, if not more, which the main one is neurosurgery and anesthesiology and pain medicine and critical care. And he's going to be doing a lot of the talking today because he has a lot to tell you about how to navigate the healthcare system. So thank you for joining us, Dr. Ghaly.
No, thank you for inviting me. So it's I thought to choose this topic because it's really timely, and healthcare is going through a lot of challenges. So I thought that this topic will be great, especially in your show, as an outspoken show. I finished my residency at Cook County Hospital and University of Illinois back in 1991 and 1995. I've been practicing since then. I enjoyed working in different healthcare systems, including government health system, employed group, employed hospital, solo, and so forth. And I feel that the patients has to be facing a lot of challenges. But I don't think just the patients. I think the medical care provider also faces a lot of challenges into this. So as you know, there is a lot of burnout from doctors, burnout from nurses. Many people now are reconsidering retiring early or changing their practice. This is from the medical provider wise. From the hospital wise, they're running short into the supplies, resources, because they're cutting down the reimbursement. From the insurance point, is raising the entire insurance premium and so forth. And then from the patient side, which is the center of all of this care, is in trouble. In addition to that, what is really making it worse, I see it now every day, is you get patients that they don't really trust healthcare system. And this is what I see in alarming. I see patients now coming to my office, even with word of mouth, they still questioning why we need the surgery and how efficient and what is this. And in addition to that, they also have a lot of economic restraints. Either they cannot take off the job, or they're afraid they lose the job, or there is nobody to take care of them, or their loved ones are very busy in their work and their life, and they cannot ask them to come and help. Then they put more burden in the healthcare facilities, and they think that having an insurance is everything. And actually having insurance is not everything at all, because the insurance now giving us as physicians, as surgeons, a very hard time. We used to order testing, MRIs, things like that with no trouble. Now every little thing you need to get approval and approval to approval and from approval to another approval, until the end you say, you know what, I had it. So how can you navigate all of this? Like, we can keep talking about it and everyone talk about it. So one important thing that I called from day one, and even before this turmoil in healthcare, which I wrote it in my 22 books, in every book that I wrote, is called patient empowerment and educating patients and setting expectations. And this is what patients need to start to do. So I'm going to give you an example. A patient comes to you and you're talking about surgery, and this is what the patient had. It's very easy for the patient to say, I'm not a doctor, I don't know what I'm looking at, I don't know what I need to do for this. But I think this is the wrong attitude and the wrong answer. I think now more than ever, the patient should be a doctor, the patient should be a nurse, the patient should be an insurance person. And you shouldn't rely on the other people to do this, because ultimately you only one person, you need to be advocate for yourself. And when they argue with me or talk with me, I tell them it's very simple. When you do a transaction for $1,000, for instance, you talk about it, you search about it, you do all of that. In fact, if you go ahead and decide that you wanted to buy a house, you're not a plumber, you're not a contractor, you're not any of those, but yet you actually search the foundation of the hospital, the utilities of the house, and when it was built, and how it's built, and how much it matches this with this. And this is healthcare. So it's no longer patients should be intimidated by asking questions and asking doctors, but they should be by the knowledge. They shouldn't be manipulative. They should be malicious. They shouldn't hide from doctors what they know. They can come with a booklet and write down what they've been told and compare notes. I see patients coming and they're not telling me much of their history, and then they expect me that I can read their minds or I can access through electronics. And this is a big joke, by the way, about electronic records, because I remember back 20, 30 years ago, electronic records means that you share the information easily and what this is, but now you actually can share the information in the healthcare system that you work on. So it becomes very convenient to the people that work in that facility. So if you're a primary doctor, you send to a surgeon, you send to an anesthesiologist, you send to a pain specialist in the same facility, they all can access. And this is good if you remain in the healthcare system. But if you're going to change your healthcare system, we have a very hard time getting any data. I cannot get it through the computer. The patient has to go in person, and it takes forever, and you don't even get the old data. And this is important because if you don't know everything about the patients, the problem is you may miss a lot. So it becomes like you need to know about yourself, right? I tell them, write a small little card. What is the medication? What is your medical problem? What is the date of surgery? What you're allergic to, and put it in your bucket. Always remember, doctors are not really, they cannot read minds. The other thing, don't trust the system. I'm happy they don't trust the system, but they need also to work to trust something. You know what I mean? You need to know what you have, why you have it, what was your symptoms at that time, and share it with the doctor. One thing that I see patients are doing recently is testing the doctors. Well, let me not tell him what I have, and let me tell him what I know from the other doctors. Let me see what he's gonna say. Well, if you do this, if the doctors doesn't have the information that he needs in order to make a decision, because he's also a human being, errors can start also. So the best thing is not to test the doctor or tempt the doctor or tell the doctor, let me see what he knows, or all of this. Just share the information. And this is all under something called communication. So we know for a fact that communication is the single sole problem in medical errors or making mistakes and things like that. You have a patient, for instance, that in a blood thinner. Patient did not know that he's in a blood thinner, that the name is Blavix. He depends on the hospital records that he is in Blavix. He thought that the doctor knows that he's supposed to be in Blavix, comes for surgery in the middle of the night. The anesthesiologist that doing the case that doesn't know much about the patient, the surgeon that doing the case that doesn't know much about the patient, did not realize the patient in Blavix because this information wasn't there. They do the surgery, the patient can actually suffer from a major complication because the blood thinner means that doesn't stop the bleeding. So the surgery will have a problem, the anesthesiologist will have a problem. Ultimately, the patient will suffer. So how you can take care of that? First, have your summary of your medical issues. I see in the iPhone, for instance, that I have, there is so many ways. There is book notes you can save. I save a lot of important files in my phone. So why don't you do that? Why don't you access your file and save it and put it in the phone, for instance, and have it under your information so that when they go to the doctor office, here is my all medical problems. The other thing that I also advise the patient to do, when you go to a doctor, to a neurosurgeon like me, I will love to see the last clinic note from your primary physician, the last data or the labs of that patient. This is help. The patient will say, what is this going to help you with? I did not go to my primary physician. He doesn't even know about my back pain. But I keep telling them that patient is only one unity. There is a reason why I got bored in neurosurgery, anesthesia. I did all my 50 years of training in medicine. It's not even enough because I feel human being is one. And you only one chance, and any screw up, you'll suffer a lot from it. The more you know about the patient, the more you never know how this information will help the doctor or help yourself. When I say help the doctor, I don't mean the doctor himself. I mean that it helps the doctor to help the patient. So now I provide the medical doctor with all these informations. So make the data available, make also the essential drugs available. This is great. Then start to learn. For instance, I have a patient that comes with lumbar disc herniation. And so all you have to do now in Google, oh my God, and even the chat AI, you don't even have to write it. You can talk. You say, hey, voice, tell me about the lumbar disc. Oh, voice, tell me about, I heard something about TIA. Tell me about TIA. So when patient comes, tell me I'm not a doctor, or they tell me, well, I don't know, I wasn't trained. Doesn't fly in 2023 at all. Now you can chat AI anything you want. And then by providing this, you go to the doctor very actually knowing what you have and you're familiar with the subject. The other thing is, after all these years, I came to a conclusion that the best person knows about himself or herself is actually the patient. The patient tells me, I am the doctor, I'm supposed to know about the patient. I tell him, no, you're supposed to know about yourself. So it's not uncommon for me, I'll ask the patient, what do you think your problem is? I don't want you to write exactly specific the entire map, but I see patients, beautiful patients say, I really think I have a pinched nerve coming from the neck. I don't know from where, but I think the neck is the problem. But you have hand numbness. How did you know that related to the neck? He'll say, I just feel my neck came with this. It has to be from the neck. That is a superior patient. Or the other one say, I have migraine headache for years, but this particular headache is very different. Why? It's coming in my top of my head. It's all the time. My vision was always okay. Now is not okay. This is a good patient. This is a patient that knows himself. We struggle in our life when we make a lot of mistakes. The reason is we don't know about ourselves. We need to know who we are. And the only person that does is you and God. And hopefully every day you see things and you start to understand and reflect by yourself. So a patient comes, say for instance, the leg is very weak. Well, there is so many things that the leg can be weak. It can be from, for instance, ALS, neurologic problem. When it comes, it usually comes gradual, it comes painless, things like that. Or it can be from a disc herniation, or it can be from a tumor in the spine. You cannot let the doctor guess where it is, but provide more information, write more diary. What does diary means? So I will write diary. My norm, I just started by having a back pain. I was twisting something or I was golfing something. And then in a week later, the pain progressed, went to my buttock area, went to my foot. Makes a lot of sense. The doctor immediately tried to digest all this information and help the patient to identify. So what is the second message that I try to convey to the patients? Other than you are the doctor, you are the nurse, teach yourself, be knowledgeable, search. There is so many, the library is no longer the public library in downtown Chicago and you have to take the subway to it. It's in your phone. And this is what all our outstanding technology now that made this knowledge available in the fingertips of you. You don't even have to know how much the doctor makes, because a lot of people think the doctors makes a lot of money. When I do craniotomy brain surgery, I make only $500, $1,000 or something. So you don't just come and attack the doctor.
You should become a dentist.
Yeah, you don't come to the doctor and say, hey, I know that this is your job and you do all of this stuff. You have to know certain facts. So what is actually the next thing that the patient do? Share the information. This is important. Share the information, be honest, be upfront. Don't have the physician keep probing you for information. I love when I see the patient say, I did this is what I have, and this is what happened, and so forth. So you share the information, both of them.
Well, excuse me a minute. It's funny you're saying that, because I have a friend who has seen many doctors who have not examined her and won't listen to her. And I think she tells them too much. I think she's getting them so they don't feel like they have to do that. You're saying the complete opposite.
Yeah. So this is now a different issue that from the healthcare point of view. So I'm trying to talk about how patients try to secure that the decision to make is right. Now you're talking about something important, which is the degradation, and that's why I call it failure of healthcare or failing healthcare, because this is what happened. It's not even that. I wish it's only that the doctor has 60 patients to see. I see about 4 patients a day. I'm not a good business model. I believe I'm very busy because each patient I spend 2 or 3 hours to try actually to make a diagnosis. And I wrote an article about the art of medicine still to make the correct diagnosis. But to make the correct diagnosis, the doctor does not get paid unless he does procedures. So it ends by the mediary, whether the nurse practitioner or the clerk or somebody fills into the application. What are you going to do? We're not going to fix the system because it's getting worse. Now the graduating doctors are believing in shift. Shift means I'm working from 7 to 2. I'm going to take care of John. After 2 is another person to take care of John. And after 8 is another one to take care of John. It's no longer John can say, my doctor is Dr. Ghaly. I see him in the clinic. He's going to come to the hospital to take care of me when I'm sick. He knows everything about me. These days are gone. So now we're talking about shifts, and they think that the electronics is going to continue to be the connections of that. So what is the treatment for that? When empower the patient. Once you empower the patients, you go and you demand. You say, no, let me correct this. I dictate the notes in the front of the patient. I need the doctor to examine me. I need to know why this is it. Not in a disrespectful way, it's a respectful way. And when a patient comes and tell me, doctor, no, I'm allergic to latex, you forgot that. I should appreciate that. So this is really to try to complement. My concentration is this talk, how to try to help the patient to navigate through the failing healthcare system, because it's going to continue to be worse. There is a lot of financial constraints, resources issues. So the only way to take care of it, by empowering the patient, lifting the patient up, and start to trust himself or herself, and then start to shop around and Google. All the information is available. This is what I can say.
Well, you know, you mentioned that they're changing shifts and they're called hospitalists.
Yeah.
And I don't like hospitalists at all.
Yeah.
And I've dealt with them a lot of relatives and patients. And they don't know the patient. And they actually are trying to get them out fast because they get paid extra money for it. And
Yeah.
they've told me that themselves.
Yeah.
So, you know, there's a lot of things that you're fighting as a patient. And even as a medical person with your relatives in the hospital, you're fighting all kinds of things. I had one doctor that I wanted to do a culture on a foot that was infected, and he was the head of epidemiology, and he said, cultures don't work. I said, they don't work. They've been working for the last 50 years. He said, well, I teach that they don't work. And he didn't do it, and the patient had 3 infections when he was taken to another place to be checked out. So you really have to fight in the healthcare system now. You not only have to be educated, but what you're saying is great. However, I see that a lot of people read medical things and they really don't know what they're reading. So they get themselves all upset about some things that aren't even happening to them.
So when you come, and this is all good points, when you go to the doctor now, they have specific questions. For instance, I see a patient said, I read in my report I have stenosis. So instead of coming to the doctor and say, I don't understand this word, they can say, wait, I looked up and this is the stenosis, what it means. Can you teach me more about this? One important thing that I see we fail is the curiosity and the trust. I see patients now questioning the doctors and they believe that they're not telling the truth, or they're not trusting in the hospitals or the healthcare system, and this is messing up a lot. Here is another point. When you have an obstetrician that taking care of you in the clinic, now delivery, they call this obstetrician, hey, Joanna, come and deliver me. Now you go to the hospital, actually Joanna will not deliver her because Joanna take care of the outpatients. There's a different one here.
Right.
I don't think that we're going to change the system. I think that we need somehow to connect the dots, and unfortunately the person that's center of this is the patient, and we rely, unfortunately or fortunately, in the patient to be the center. And let's face it, the words that the lawyers love and the patients use it is, I'm not a doctor, I just was told what the doctor said. Well, doesn't fly anymore. You can be a doctor, you need to know yourself, and we help you here to make a diagnosis, and then you can go for other opinions. I teach him how the MRI, here is what the MRI looks. What do you think we should do? You don't have to be a doctor to tell me that there is a big thing is pushing in something that it needs to come out. So things like that. So a mutual interaction. But yes, this is just hopefully the first conversation session in the Outspoken show to talk about this, and then you can bring me examples and we can figure
Well,
out.
they also see commercials about all kinds of drugs. You're supposed to go to your doctor and tell him, give you this drug. And you might die from it at the end of the commercial.
Yeah.
But, you know, it's ridiculous now.
Yeah.
It's ridiculous because people don't understand all that
Yeah.
stuff.
But this is, you put it under oversaturation, and this is every human being now in modern life is. My phone has 15,000 emails and 15,000 rings, and I'm a simple person. Imagine now everybody like this. So we're in it. Hopefully that we can come to control these things. So, but you know what I mean? This is what is, wait until the chat AI comes and see what other issues is.
Well, your phone is like Einstein. It's like having Einstein for your best friend.
Yeah.
However, you can cause yourself problems by getting into things you don't understand.
Yes, yes, yes. But communication, other things we can do. I think this is at the beginning of more issues to be discussed.
Well, I know that you do anesthesiology too, and I've always told everybody that the anesthesiologist is more important than the surgeon. And we scrubbed in surgery. They don't do that with nurses anymore when they're teaching them, but we did do that for months. And you are really right here when you're under anesthesia.
Because I came as a persecuted Christian from Egypt, minority, and I always strive for the opportunity. And when I came to this country, I couldn't believe how much opportunities I have. I wanted to learn about pediatric, gynecologist, obstetric, about neurosurgery, about anesthesia, and it's never enough, and I'm still learning. The other thing I wanted to tell you, not only the shifts now that you're graduating, not only what we're talking about, the new thing happened after COVID is locums now, agencies. Now nurses are quitting, doctors are quitting, and they're working for a locum company. So here I am, gonna fly to Mississippi. I'm gonna cover the ER for 2 days. I'm gonna go back to Chicago. Oh, what's your name? My name is John. I live in Chicago, but I'm coming locums. And I thought the doctors didn't like it. I did not like it. I said, there is no way that the nurses will actually do that. But all the nurses are jumping in and they love it.
They get paid more to be travel nurses.
They can, but you call, do you know what is the futures? No, you know what I mean? Do you know, you work in an institution, you don't know the staff, you don't know any, but they like it and they work hard. What do you like? Well, I come here for my shift 7 to 7 and I leave. And I get paid. I don't go through the bureaucracy and the emails and all of this stuff. That is why we are in turmoil. That is why the topic of this is how to survive the failing healthcare system.
The system used to float from floor to floor.
Yeah.
But that was even difficult to do. If
Yeah.
you worked in psychiatry and they floated you to medicine, then you weren't used to that. You didn't, well, even if you knew it, you didn't know where things were.
Yeah.
You know, it's very difficult to
Yeah.
do that.
Yeah.
But now they're going, like you said, from state to state because there's a lot of money in that.
So what is the solution of this? This country have built compared to the rest of the world. I came from Egypt, from the Middle East, from all of this. It's so much turmoil, so much not even good spirit to build the country, and this is, but we came to this country because we need to think positive, we need to meet the challenges, we need to work as a group, we need to speak, and that's why you have the Outspoken show. We don't need to continue to complain and point fingers, but we need to sit as a group and do. And I think this is open. If you go to the hospital administration, if you go to your local hospital, to the boards and say, hey, can we sit down and talk with you a little bit? We have some challenges and let's talk about it. I'm not seeing that. I'm seeing the healthcare are fighting, the hospital are fighting, the doctor are fighting, the nurse. I think we need to grow up and we need to start to say, we are for the patient, let's work together for the challenges of the modern technology, because it's here to stay.
Well, everybody's under a lot of pressure in every profession now.
Yeah.
And that causes a lot of problems that didn't exist before.
Yeah.
So everything's in sound bites now. You go to visit a doctor many times and there's 15 minutes allowed, like you said.
Yeah.
And how can they do that? I mean, we used to do grand rounds on patients and sit for hours, even with several doctors and nurses together to figure things out. Do they ever do that anymore?
No, but it's interesting you say that, because when I sit with patients for an hour or two, I see some patients appreciate and some patients look at me down and said, if this doctor sit with the patient for 2-3 hours, he's probably not busy and I need to find somebody else. I'm serious. Now the situation when I see, it's very different. Like I used to see patients acknowledge and appreciate all of that. Now, if you give them more, they'll say, oh no, there is a problem in this guy and all of this. So you don't know what is it.
Well,
you know what I mean? A lot of them likes to have, the layers. This and this, so I don't know.
Well, I had to laugh the other day. I watched the real stories of the ER because I used to work in the ER, so I want to see if I still know everything. So I diagnosed something, and they had 4 different specialists on there. They all came up with different diagnoses. I thought, well, I've lost it. I don't remember anything. It turned out my diagnosis was the right one, and it was only cellulitis from a cat scratch, as a matter of fact.
Yeah.
But that happened with a friend of mine. She called me, and she said, I have this gout, and it's not from my diet. It's genetic. It's this, it's that. My leg's all red. I said, well, you make sure you don't have a blood clot, and I went through all that stuff. I said, all you have is cellulitis. She said, well, the doctors don't know what it is. And I said, go to the doctor and tell him it's cellulitis. Get a medication. And she did it, and it went away.
Yeah. So how you summarize what the story that you just said is called common sense. But we have a lot of arms now. We do CAT scans for everything. The issue now, I used to be good clinically. I look at the patients. I can actually know a lot with my hands. It's called hands-on care. Now, the technology and the modern technology, they said robot is actually better. The sensors is better. Wait a minute. The watch, the Apple Watch can know my heart rate, my everything. My technology, I trusted much more. People are forgetting and all of this. Oh my God, there is a lot of issues with that. If you do like this show and this topic that we talk about, we should do more of this, or maybe we can present 1 or 2 stories and we'll see how to navigate.
I have to tell you, my nephew, when he was about 6 years old, had symptoms of the abdominal pain. And I went over there and I said, he doesn't have appendicitis, because I tested him and everything. I called the pediatrician. I said, he could see in the morning, he doesn't have it. She said, okay, bring him in the morning. They did all these technological tests. They wanted all, I said, he does not have an appendicitis. They took him to surgery because my brother and his wife like immediate results, He didn't. He had one little lymph node that was enlarged, and he went through surgery for nothing. And all the machines told them to do that. Doctors didn't used to do that.
Yeah, I agree.
And doctors used to say, don't worry about it, I'll take care of it, I'll fix it. Now they go, you might die from this, but, they come from the other side. They scare people to death.
Yeah, so and this is a disadvantage, and we did it to them. I think we are the problem for the next generation. We took them away from the patients. We told them you need to work only for 60, 70 hours. You need to sleep. You need to have 70 hours. You need to do all of this stuff, and you took them away. And you said life is not about work, it's about a lot of other things other than work. And this is what happened. What are you going to do? I used to be day and night in the hospital, only take a break 1 hour to go to my little unit to take a shower and shave.
I know,
you know
but
what I mean?
you are unique.
Yeah, but no, there was so many of us.
I was there.
Yeah.
We got to give them your phone number.
Oh, my office number is 630-978-7500. I'm not sure they will call me
Say it one more
after
time.
this.
Well, if they're smart, they will. Let's put it that way.
630-978-7500.
And you have a website.
Yeah, and my website is www.GhalyNeurosurgeonByN.com. So GhalyNeurosurgeon.com.
And Ghaly is spelled Ghaly, Ramsis Ghaly.
And we would like to applaud and celebrate Karon. She's a head nurse, outspoken, but here's the catch. Whatever she's doing for the last 40 years is no pay, no money, nothing. It's just an outspoken, telling people what this is how the wonderful nurses that they used to be in the past. They used to give their heart and all their efforts. Now they telling them business stupid. They tell me I'm business stupid because I work for free. She works for free. They said you have to work smart. So at this point, Karen's not smart,
it's not
and I'm not
money.
smart.
It was never
oh my God!
money.
And this is about human beings. So hopefully,
well, thank you for joining
we'll
us.
inspire
I'm sure
them.
it's cutting us off now.
I'm glad he does.